Taking your child for a neurological exam, it can feel pretty overwhelming, right? But what if we thought about it differently? What if it's less like a scary test and more like a really cool piece of detective work? Well, we're going to break down exactly what that means.
So, yeah, today we're pulling back the curtain on the whole pediatric neurological exam. And the big idea here is to stop seeing it as just a bunch of tests. Instead, I want you to picture the doctor as a skilled detective, you know? They're carefully gathering all these little clues to build a complete picture of your child's health.
And you know what? Before a single stethoscope or reflex hammer even makes an appearance, the most crucial first step is just connection. The doctor's number one goal is to make sure both the child and you, the parent, feel comfortable and safe. It's all about building that trust because, let's be real, a relaxed kid is going to give the clearest clues. In fact, this initial connection is so important that it's actually been formalized into a protocol they call WIPE. It's an acronym, right? It stands for wash hands, introduce yourself, ask for permission, and ensure proper positioning and exposure. Just those four simple things, they set the entire tone for the exam. It's all got respect, safety, and clear communication from the get. Okay, so with the stage set and everyone feeling comfortable, the real detective work begins. And this first phase of the investigation, it's all about observation. The doctor starts gathering clues literally the second they walk into the room, just by looking around. And to make sure nothing gets missed, doctors often have this little mental checklist they run through, something like the ABCs of observation. They're looking at the child's general appearance and alertness, their body posture, any unique marks on the skin, what they call cutaneous signs, and even any equipment that might be nearby. Every single observation is another clue for the file. All right, so after that initial observation, the focus shifts to the body's main command center, the brain. And more specifically, the exam starts to zero in on the cranial nerves. Think of these as the brain's direct phone lines to the face and head. Now, you might hear that there are 12 of these cranial nerves and think, whoa, that's a lot to test. But honestly, the reality is way simpler. The exam isn't some exhaustive pop quiz. Instead, the doctor is just focusing on the most important functions these nerves control. You know, the stuff we all do every day, like seeing, smiling, and hearing. And the way these tests are organized is actually pretty brilliant. They basically get split into two simple categories. You've got motor tests, which are all about doing things, and sensory tests, which, you guessed it, are about sensing things. So the doctor might ask your child to make a huge smile or puff out their cheeks. That's a motor test. Then they might check their vision or whisper a word. That's a sensory test. Super simple actions that reveal incredibly complex information. Okay, so we've gone from the command center in the head, and now the investigation moves out to the rest of the body's wiring. The next batch of clues comes from checking out the arms and legs, and specifically, the doctor's looking at two key things, muscle tone and muscle strength. So, muscle tone, what even is that? It can be a little tricky to wrap your head around, but it's basically the amount of natural tension a muscle has even when it's completely relaxed. This is key. It's not about strength. The doctor checks it by gently moving the child's arm or leg themselves, just to feel the level of resistance. It's a super subtle but really important clue. Now, strength, or power, that's a different story. That assessment is way more direct. To keep it objective, doctors use a simple 0 to 5 grading scale. 0 means there's no muscle movement at all, while a 5 means the child has full strength and can push back against the doctor's resistance. It's just a clear, universal way to talk about strength. And how they do this is so important. Instead of some sterile command, the doctor will usually frame it like a game. They'll say something like, okay, I'm going to test how strong you are. Don't let me push your arm down. That simple shift in language turns a medical test into a fun challenge, and it really encourages the kid to participate and give it their all. All right, so let's recap. Our detective has checked the command center and all the body's wiring. This last part of the exam is all about fine-tuning the system. It's about seeing how well all those different parts actually work together. And this is where coordination and reflexes come into play. And the coordination tests are often these surprisingly simple movements. You've got the finger-to-nose test, right? Where the child touches their own nose, then the doctor's finger, back and forth. Or the heel-to-shin test, where they slide one heel down the other shin. These actions seem almost like games, but they're actually super powerful tools for checking in on the cerebellum, which is the part of the brain in charge of balance and coordination. Okay, so every once in a while during the exam, you might hear a real mouthful of a word, like dysdiadochokinesis.
I know, it sounds super intimidating, but all it really means is having a tough time with rapid alternating movements. Think about quickly flipping your hands over, palm up, palm down, over and over. That's the test. It's just another simple clue hiding inside a really big word. And of course, we have to talk about the classic reflex test, with the little hammer. It's definitely not just for show. When the doctor taps a tendon, they're testing the entire nerve pathway, from the limb all the way up the spinal cord and all the way back down again. That quick, automatic little kick, it reveals the health of the whole circuit. Pretty cool, right? Okay, so at this point, our detective has gathered all the clues. We've got the initial observations, the cranial nerve checks, the readings on muscle tone and power, and the coordination results. This is the moment where it all comes together. The doctor takes all these separate little pieces of data and starts to assemble the full picture. And they do this in a really methodical way. The summary they put together follows the exact same structure as the exam. It'll start with those general observations, then move to the cranial nerves. Then it'll detail the findings for tone, power, and reflexes in each arm and leg. And finally, it wraps up with coordination. It's this structure that turns a simple list of facts into a coherent story. And this is the crucial part. The summary isn't just a recap. By organizing all the information this way, the doctor can start to spot patterns that might not have been obvious at first. For example, is there weakness only on one side of the body? That could point to an issue in a very specific part of the brain. The structure is what helps reveal the story that's hidden inside all the clues. And ultimately, this super structured summary leads to a really powerful conclusion. It allows the doctor to say something like, okay, these findings are consistent with, and logically connect all the evidence they've gathered directly to a potential diagnosis. It really is the climax of the detective story, the part where the mystery finally gets solved. And that's really the main takeaway here. From that very first hello all the way to the final tap of the reflex hammer, none of it is random. Every single step, every simple little movement is a carefully chosen piece of a much bigger puzzle. And it's all designed to reveal the inner workings of a child's neurological system. So, you see, far from being this intimidating series of scary tests, the pediatric neurological exam is actually this elegant, systematic, and incredibly powerful tool. It's a process that's designed not to confuse you, but to bring clarity. It's designed to provide answers, and, most importantly of all, to guide the best possible care for a child. It kind of leaves you with this one fascinating question to chew on, doesn't it? How can such simple, almost playful movements reveal so much about the absolutely breathtaking complexity of the brain and all its wiring? It's just a beautiful example of medical science at its most insightful.